Thank you, Mr. Chairman, for convening this important hearing, and thank you to all of our witnesses for joining us here today. This preventable border crisis is costing taxpayers billions of dollars each year, while schools and hospitals are overwhelmed by a surge of illegal migrants. Last year in Florida, the healthcare cost for illegal aliens was nearly $340 million, with taxpayers footing more than 2/3 of the cost. As we've heard in prior hearings, this crisis is about even more than just the bottom line financial effect. It is a crisis of humans. It is a crisis of human loss. We've heard testimony about human trafficking, unnecessary deaths from fentanyl poisoning. A recent Florida grand jury investigation into this administration's policies established that since January 2021, approximately 165,000 unaccompanied children nationwide have been given to someone who is not their parent or legal guardian. Approximately 90,000 have been turned over to someone who claimed to be a family member without DNA testing and without adequate verification. About 30,000 have been surrendered to someone with whom they have no known relation. I spoke to my local sheriff's office in anticipation of today's hearing to ask how this crisis at the border is affecting our local community in Florida. And I learned that our county sheriff's office in Pasco County was forced to create 2 major crime squads solely for investigating overdoses. These squads are comprised of 5 deputies and cost over $1 million annually. I am so grateful for their work to combat this epidemic, and I recognize how difficult it is to perform these additional tasks and respond to these additional calls without the necessary resources. The human and economic toll of the border crisis is felt in communities across America. Mr. Lyons, on that subject, I'd like to turn to you. You've already touched a bit on the impact that illegal immigration is having on police departments, especially in rural areas. Would you expand on how the increase in 911 calls in response to incidents related to those crossing the border is affecting your resources and your ability to perform your duties?
We've seen a significant uptick in people who come to the border who do not want to wait. And sometimes they've had to wait up to 24 hours during the biggest surges, sometimes 36 hours. We've seen them order Uber Eats, but most particularly in order to expedite their removal from the border into a facility so that they can, quote unquote, get where they're going, they resort to calling 911, which ties up our system. And everyone in our 911 system must respond. So you have a tribal shared a 911 responder or first responders that will respond, then San Luis responds, or the city of Yuma, and then we have Rural Metro, which is a contract. And those have tied up resources so that they have been unavailable, especially during the height of our season when we have a significant uptick in visitors from the northern United States and Canada being in Yuma, and also our agricultural workers. And they are responding to calls that are not medically related. It's simply with people who want to be removed from the border.
And have you heard any stories of other places in the country that are similar to what I shared about Pasco County, where local law enforcement is being forced to expend additional resources and deputies or officers to respond to the fentanyl crisis?
Yes, absolutely. And in Yuma County, with Amberley's Place, we just received a grant from Arizona Department of Emergency Management where we are able to go out with 2 different agencies. It's a $500,000 grant and focus on human trafficking along the border specifically, but through Operation Stone Garden, which is federally funded, and we very much appreciate Operation Stone Garden. Our state and local law enforcement are able to put additional resources out into the field to go after those that are trafficking fentanyl. And it's interesting, a side note, when we see the numbers dip in people coming across, they tend to have the ability to interdict more fentanyl because they are focused on border security and national security at that time rather than processing.
You also mentioned in your testimony the effect that the border crisis is having on healthcare and hospitals. Would you expand for us on the effects you see on hospitals?
We have one hospital that serves our community, and every day when I wake up, I am interested to see who is texting me during the night and what they've had to do because they haven't been able to access our hospital. I had several people tell me that they had to travel to San Diego or to Phoenix to deliver their baby or to have regular surgery that had been scheduled, that had been put off. So we had an 18-month period where it was almost impossible to go into the hospital, which also detracted from Border Patrol's ability to man the border because you have to stage a Border Patrol officer with an individual who is at the hospital. And so for every 20 or 30 people that were in the hospital, those were agents that were there guarding them and not being able to be on the line.
Thank you. Mr. Chairman, I yield back.